Hello, health champions. Welcome to Wellness Wisdom. Is it possible to reduce inflammation by changing our diet? The answer is yes. There are many scientific studies showing that certain foods cause inflammation, while others reduce inflammation. Some people have chronic inflammatory diseases like rheumatoid arthritis, ankylosing spondylitis, and ulcerative colitis, and they report improvements in their symptoms when changing their eating habits. Today I'll answer some questions. What is the anti-inflammatory diet? Is it healthy? For how long do I have to try until I see the benefits? So let's talk about the anti-inflammatory diet today. First, I need to explain what inflammation is so you understand why the anti-inflammatory diet is so important. And maybe that will help you adhere to this diet for the rest of your life, not only for a few months. Inflammation is a normal reaction of the body to any threat, insult, trauma, attack, or infection. Your immune system reacts by sending white blood cells to combat the insult, for example, to kill the bacteria or eliminate the cancer cells. However, in autoimmune diseases, there will be chronic inflammation that is not normal. Autoimmune diseases occur when your immune system recognizes your own cells as something threatening, and then it will start attacking the normal cells. This is what happens in rheumatoid arthritis, psoriasis, ankylosing spondylitis, inflammatory bowel diseases, some types of thyroiditis, type 1 diabetes, multiple sclerosis, and, well, many other diseases. Fibromyalgia. We don't know if fibromyalgia, which is a chronic pain condition, is an autoimmune disease or not, but there are some recent indications that people with fibromyalgia have some chronic inflammation going on, because there are some inflammatory markers that are higher in people with fibromyalgia. Obesity and inflammation. If you are overweight, pay attention to this. Fat tissue releases pro-inflammatory molecules such as leptin and cytokines. So even if you adhere to an anti-inflammatory diet, your levels of inflammation may not go down because your body is constantly releasing these pro-inflammatory substances from the excess fat that you are carrying around. Before I continue, remember that this video is for educational purposes only. If you have a condition that needs medical advice, please talk to your doctor. And if there is an emergency, go to the nearest emergency department. I usually do not recommend my patients to do a radical diet for a few months, and then return to their regular diet. I think that doesn't work. My approach is to incorporate healthy eating habits into your life for good. If this diet is overwhelming to you, try changing one thing at a time. It is better to go slow and stick to it than to abandon it because you could not persevere. What is an anti-inflammatory diet? I'm sure you will not be surprised by it, as there is a lot of common sense in this diet. If you know someone who needs to see this video, press the share button below and send it to them. So first off, it's important to avoid refined carbohydrates and gluten. That means steering clear of white bread, white flour, and anything with gluten in it. Instead, you can try gluten-free flours like almond flour, oat flour, brown rice flour, corn flour, tapioca, or even cassava flour. Next up, let's talk about sugars and sweeteners. You really want to avoid white sugar, any kind of sugar, or artificial sweeteners. A good alternative is to use homemade sugar-free jams or just stick to plain fruit. It might take a bit of time for your taste buds to adjust, but once they do, you'll probably find that sweetened foods actually start to taste unpleasant. And finally, let's look at pops, soda, and carbonated drinks. It's best to avoid all soda and carbonated beverages. You can replace them with water, homemade teas, freshly squeezed citrus fruits, or even berry smoothies. So let's talk about processed food. It's really best to avoid processed foods whenever you can. Instead, try to replace them with fresh, raw vegetables and fruits. And when it comes to meat, swap out processed meat by buying raw meat, poultry, or fish, and then just cook it yourself at home. Honestly, many people don't even realize what processed food actually is. Basically, if the food has been cooked, canned, frozen, packaged, or modified with preservatives or additives, it's considered processed. Even healthy ingredients, can actually become unhealthy when they're processed. Take fish, for example. Fish by itself is super healthy, but once it's processed, fried, or preserved and comes in a box, it's really not the same anymore. Now let's talk about trans fats and hydrogenated oils. You should really avoid trans fats and hydrogenated oils as much as possible. Make it a habit to read labels. These unhealthy fats are often found in things like margarine, shortening, hot dogs, cookies, muffins, frozen pizza, microwave popcorn, and so on. Instead, try to replace them with healthier fats, like extra virgin olive oil, canola oil, and nuts such as walnuts and almonds. When it comes to red meat, you don't need to eliminate it entirely from your diet. Instead, try to limit yourself to 1 or 2 meals per week. You can replace red meat with options like beans, lentils, chickpeas, quinoa, bulgur, brown rice, oatmeal, and green leafy vegetables such as spinach, kale, and broccoli. Now, talking about alcohol, it's really important to reduce your intake. Try to avoid sweetened cocktails and beer. If you do choose to drink, you might want to consider having just 1 glass of red wine a day, since it contains antioxidants. And finally, let's chat about coffee. It's best to limit your coffee intake and avoid adding too much cream, milk, sugar, or sweeteners. You could try replacing some of your coffee with green tea, which also contains antioxidants. So try to avoid grabbing packaged snacks, especially when you're tired or in a rush. Instead, it's a good idea to prepare healthy snacks in advance, like, containers filled with nuts, fruits, or even leafy greens ready to toss into a salad. Spinach, kale, and collards are honestly excellent anti-inflammatory ingredients. Use them generously in your meals. Is this diet healthy? Absolutely, yes. The anti-inflammatory diet is in fact a healthy diet. Even folks who don't have chronic inflammation or pain may still benefit from following it. So plan your meals and ingredients before you go grocery shopping. It really helps to make a list, Next is shop. Buy only what's on your list. Try to avoid those processed food aisles and instead, take some time to explore the fresh produce section. Now cook. Prepare your meals at home as much as possible. Maybe limit takeouts to special occasions. It's a good idea to invest in some solid cooking tools, and you can also cook in bulk and freeze portions for later. That really makes things easier. Eat mindfully. Enjoy the aroma, colors, and texture, Eat slowly. And make mealtime social if possible. Here's how I do it. I memorize most recipes and shop once a week. I cook dinner daily and calculate for 8 portions, 4 for dinner and 4 for lunch the next day. Extra portions are frozen for busy days. We eat dinner together most days, and everyone takes a lunchbox to school or work. Remember, we are what we eat. Watch my next video about vitamins, nutrients, and diet. This is an extremely important topic, and honestly, not enough doctors emphasize it. Don't forget to subscribe to this channel. Goodbye.